A health worker in Montreal is now sharing her experience on the front line in a Quebec care home. Terrie Laplante-Beauchamp was working as an orderly at the LaSalle Centre in Montreal earlier this month. She has shared her diary entries from that time with the Globe and Mail. It is worth a read. It describes the horrific conditions that she says residents were living in and workers were trying to work in. 99 people at that home have now tested positive for COVID-19. That's half of the clients, and Terrie herself has also just tested positive for COVID-19. She joins us this morning. Terrie, before we start about your experiences, I want to ask how you're feeling.
I'm feeling a bit better than yesterday, but still a bit drowsy and a bit groggy, but I'll be okay, I think.
Can you share with everybody about the conditions at your time working at the center? I mean, the diary entries are shocking to read.
Yeah, for sure, they're shocking to read. It was a shock to me the first day I got there to see that we didn't have any protective equipment for everybody, and also we had to keep the same gown for one evening or the masks for 4 hours at a time when it's supposed to be throwable after a few minutes or one patient or something. And it was just a bit shocking to see how unwell we were protected, really.
Well, and then no surprise that workers like yourself have now contracted the virus. 28 of the center's residents have now died. How are the other residents and staff doing who are still there?
Well, on my unit, which is the COVID-19 positive unit, the residents, they're completely confined to their rooms. It's really sad to see because they're mostly really depressed. They tell us that they're depressed on a daily basis, that they want to die, they can't take it anymore. It's really hard for the orderlies as well because they're seeing their patients die one after the others, and they love their patients and they really want to do the maximum for them, but they really can't because, I mean, we can't enter the rooms at all times. We have to restrict the number of times that we enter in a room to reduce the risk of transmission.
I should tell you, Terrie, we reached out to the center and they told us that since you were working there, they have taken a number of measures, including ordering more personal protective equipment, moving residents with COVID-19 to a containment zone that wasn't happening before, improving communications with residents and families, and reminding staff of precautionary measures. They also told us after a visit on April 11th, all levels of care were found to be up to date. Are those the changes that you wanted to see?
Yes, so I've heard. I'm really happy that they took that they did this because that's what was needed, really. I just wish it would have been sooner because, like, what did it take to do this? It's kind of unbelievable to me, but yeah, I'm really happy that they did this finally because they had to, really.
What are your concerns for staff and for residents going forward?
Well, for the residents, it's the solitude, really. It's being confined 24/7 in their rooms. It's really depressing. And I mean, like, some of them, they're telling us that they don't see any point in continuing living. And one of my patients actually died a few days after telling me this. And it really was heartbreaking. And for the staff, well, of course, better salary, better working conditions, that would be very important for sure.
Terrie, I want to thank you for sharing your story, not only with us here on Your Morning, but with the rest of the country by sharing your diary entries. It's really good insight. Thank you.
Thank you very much.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.